Hello viewers, and welcome to the first module of the Lifestyle series, Lifestyle Management. How many of you believe that illness and wellness are opposite ends of the same coin? Perhaps not, because wellness is not merely an absence of illness. And the one factor that pushes you on either side is the lifestyle that you lead. And Professor Kennedy studies this lifestyle in the various centers that he runs across the country. The statistics that these centers bring to us is truly eye-opening. It would be interesting to know the suggestions that Dr. Kennedy would like to make to viewers to lead a healthy lifestyle.
Friends, today we will be talking about lifestyle management. If we were to look at the cause of disease over the centuries, we would find that in early history, man did not live beyond 30 years and died mostly due to violence, either inflicted by his enemies or perhaps by wild animals. In order to protect himself, man began to live in communities. He protected himself from animals and from his enemies, but a new type of disease infested, and that was communicable diseases. Poor sanitation, living in proximity with each other, created a new spectrum of diseases: malaria, plague. These were the new diseases. But by the beginning of the 19th century, modern inventions of antibiotics, medicine, drugs, modern hospitals, all communicable diseases were brought under control. And today the World Health Organization says that diseases such as smallpox and cholera that were earlier pandemic are now controlled. But with modern times, with the open global economy, came new stresses and new tensions. With modern amenities came low levels of activity. With the open globe, nutrition from one country to the next country became abundant. So today we have a situation of overabundance. We have the diseases of excess rather than the diseases of want and poverty. These diseases are diseases of developed countries and the diseases of urban organizations, urban cities. These diseases are controlled, created by lifestyle. So how does one remain healthy within the modern scenario? The first step is to have a medical check. Why does anyone need a medical check? You need a medical check because all modern diseases are silent. Infectious diseases of old had temperature to indicate that there was a disease. Modern diseases have no symptoms. Hypertension, diabetes, hypocholesteremia, heart attacks have no symptoms that you can recognize, and therefore you need a medical check to be able to use diagnostic equipment to go inside the body to understand where the illness lies. Step one is a medical check. Step two is to eat the right food in the right quantities. Hypertension and salt are correlated, we know this. Diabetes and sugar are correlated, we know this. The heart attack and fat is correlated, we know this also. We also know that antioxidants contained in fresh vegetables and fruits protect us from cancer. So the food that we eat can either be our medicine or it can be our poison. So the second rule of good health is to eat the right food. The third rule of good health is activity. Today, we are using our mind and not using our body enough. This creates a whole range of diseases. Obesity is the first. 50% of urban populations, including children, are overweight. Now this leads to hypertension and diabetes. It leads to back-related problems and osteoporosis and arthritis. It leads to psychological dysfunction. Activity and exercise, on the other hand, prevents obesity, improves the heart function, improves mobility, strengthens the body, relaxes the mind, and therefore exercise is the third important rule of good health. We must learn to relax our mind, which is the fourth rule of good health. In ancient times, we earned our food by physical labor. Today, most of us sit in chairs, use computers, and use our mind to earn our salary. This places tremendous tension on the mind. Remember that the brain functions even while you sleep. The autonomic system controls the heart and the lungs and the respiration, and even while you are asleep, the brain is still functioning. And therefore, the excesses, strains of modern day function create a whole range of psychosomatic ailments. Today, we are unable to sleep well, which means, in other words, that we must learn to relax our mind, which is the fourth rule of good health. The cigarette or alcohol, these must be avoided. That is the fifth rule of good health. So how do we relax? We have found instant foods, fast foods, and instant ways to relax. In case you were to have a cigarette, you would have instant relaxation. In case you were to have a peg of alcohol, you would have instant relaxation. Many of our children today are having narcotics and drugs, and I'm sure that that also gives them relaxation, but at a price. The biggest killer in the world today in terms of dependencies is the cigarette or alcohol. So these must be avoided. That is the fifth rule of good health. Safety is vitally important, and this is the sixth rule of good health. Old people, such as I, will probably die of a heart attack or of a cancer. But does that mean that young people today are not dying? No. Young people today are certainly dying. And the major killer of young people today is the automobile. Automobile accidents will take care of the majority of deaths of our young people. Safety is vitally important, and this is the sixth rule of good health. But safety not only in the area of work or recreation or home, but also sexual safety. HIV/AIDS today is becoming a major problem. Millions of our children and young adults are dying of this disease. So, what are the rules of good health? Number one, to have a medical check. Number two, to eat the right food. Number three, to do some exercise. Number four, to manage your stress. Number five, to manage and avoid dependencies. Number six, to adhere to the rules of safety. If we were to look at the major costs in healthcare today, what would they be? The major killers: heart attack, cancer, injury, and HIV/AIDS. The major illness factors: hypertension, diabetes, psychosomatic diseases caused by stress and tension, musculoskeletal problems. These are the factors that account for 80% of medical costs. If you were to look at the cause of these illnesses, amazingly, you would find that the causes are within lifestyle. High levels of stress, low levels of activity, a high-fat diet and obesity, smoking and alcohol, and in India, pan. These are the common factors that are the bedrock of most ailments. I've had the good fortune of having to be able to analyze the health status of 100,000 urban individuals every year. And I'm amazed to see the health profile. Without being precise, more than 50% of our urban population is unfit and do not do exercise. More than 60% of the population is overweight. That is, the fitness and nutrition profile. Let's look at the stress scenario. What is stress? Stress is mental tension. What is the effect of stress? The effect of stress is psychosomatic disease. What is psychosomatic disease? Psychosomatic disease is diseases that affect the body due to stress. And we find that 41% of the urban Indian population have multidimensional stress. Now, what is multidimensional stress? Multidimensional stress is stress coming from several sources. It could come from your personality. Today, we are proud to be ambitious and competitive and time-pressured and result-oriented. This causes stress. Some of us, especially our housewives, are passive. Our mothers are passive. They are overruled by the individuals in the home or by corporate executives. Internalizing tension also causes stress. You could have stress at home, you could have stress at work. You can also have stress in your daily routine. If you do not get sufficient time to sleep, you do not get sufficient time for recreation and exercise, if you work too long, you will also have stress. And more than 29% of urban Indians have stress that is related to daily routine. How does this manifest itself? It manifests itself by psychosomatic ailments. Psychosomatic ailments are ailments caused by stress and tension. More than 26% of us have headaches. Digestive ailments are also in the region of 24%. Joint problems, arthritis, spondylosis, even while physical, is also caused by stress and tension, 32%. Hypertension, 30%. Diabetes, 16%. And high blood cholesterol, hypercholesteremia, more than 47%. As a consequence, more than 80% of urban Indians have psychosomatic stress, for which, even while lifestyle is the answer, there is also medication. And that is why, of course, the pharmaceutical industry is doing as well as it is. What is the major killer today? The major killer today is the heart attack. And shockingly, 67% of the urban Indian is the heart attack, which means that he has more than one or two of the primary symptoms of heart attack: hypertension, diabetes, hypercholesteremia. And most frighteningly, 42% of us have a genetic cardiac syndrome or a genetic cardiac profile, which means that the heart attack can be passed down from generation to generation. And currently, 42% of us inherit the cardiac gene from our parents. The second biggest killer worldwide, beyond the cardiac situation, is cancer. What causes cancer? Smoking. More than 20% of our population smokes. And in India, we have a very specific problem of oral cancer related to pan. More than 8 to 10% of our population, urban population, eats pan. The rural population, the percentile would go up to 60%. The second biggest killer in the world is cancer, and our risk stands at about 30%. Here too, 15% of us have a family disposition of cancer. The major killer of young people is automobile and HIV. The major cause of automobile accidents is the use of alcohol while driving. That is the major cause. 33% of automobile accidents in India are caused due to the use of alcohol and sedation and medication during driving. 50% of deaths in an automobile accident are caused by non-adherence to safety factors. For example, not wearing a seatbelt. In India, very few of us do. not wearing a helmet, even while it is legally compulsory. Many of us do not follow that. HIV/AIDS is a reality today. 50% of the HIV cases in India, probably more, but certainly in the region of 50%, are as a consequence of inappropriate sexual activity. The use of intravenous needles due to drug abuse is another major factor. Research in corporate industry has confirmed that the higher paid the executive is, or the richer the individual is, the sicker he gets. We did the CEO survey for the Confederation of Indian Industry, and we discovered that in fact the CEOs of company were the unhealthiest, and the healthiest individuals were the lowest paid employees. So what are our solutions? I would suggest 4 solutions. Number 1, all medical checks must be converted into health checks, and I will explain this. A medical check helps you to identify illness. A health check helps you to quantify wellness. The second important step, we must have more wellness professionals. Today we have doctors who are illness specialists. Universities and educational institutions must create wellness and health programs and bring these on par with medical programs. Step number 3, understand that there are not enough health and medical professionals to take care of the health of the entire population. The knowledge that health professionals have must be transferred to every individual in our country. The transfer of knowledge or the creation of health management programs and education is a vital third step. And the fourth step is to make available facilities. We have hospitals, but do we have enough health clubs, gymnasiums, health parks, stadiums? We must have more of these. These are the 4 important solutions. Like I mentioned earlier, a medical checkup is important, and the World Health Organization defines that every human being must have a medical checkup at least once a year. And the reason for that is, as I mentioned earlier, modern ailments such as hypertension have no symptoms, but yet if they persist, they will convert to heart attacks, which will be fatal. A medical checkup helps you to identify an illness, but it doesn't tell you your probability of illness in future years. A health check helps you to quantify your wellness. If lifestyle is the cause of disease, then we must find ways to quantify lifestyle, to understand what is it in our lifestyle that is causing us disease. Is it our diet, or is it our stress, or is it our smoking? This will all come in a health check. We must understand, do we have stress? Are we physically fit? Are we overweight? What is our risk of heart attack? What is our risk of cancer? These are the aspects that will come up in a health check. A health check also enables counseling. You will be counseled on the proper diet, on the proper exercise, on the methods to relax and improve your sleep, and meditate on how to avoid risks of heart attack and cancer. All these come together in a health check. So, the first rule is you must convert a medical check also into a health check. Secondly, we must create more health education in the country. Programs such as the Preventive and Promotive Healthcare Program for doctors, or integrated medicine for alternative therapists, ancient wisdoms of Ayurveda, ancient wisdoms of acupuncture, homeopathy, naturopathy. These must all be integrated and must be made freely available with scientific research, but certainly ancient wisdom integrated with modern medicine is an important second step. Wellness professionals, wellness management program, wellness coaches. So it is important that we should have health education and create health professionals. Health facilities is the important step. You can have high-cost facilities such as stadiums and gymnasiums and wellness centers, but more importantly, you can have low-cost facilities, no-cost facilities. Encourage walking. Walking is a natural exercise. It enables you to strengthen your heart. It enables you to reduce hypertension, to lose weight, improve your lung capacity. For younger age groups, jogging, cycling, swimming, free hand exercises. The ancient system of yoga is excellent for health. More and more meditation. Quit smoking, quit alcohol. These are no-cost methods to achieve good health. Why do we need to look at good health? Of course, it is important to the individual. It is more important to the community. In the United States of America, $1 billion and more per day is used on health and medical care. In India, we use more than 10 crore rupees a day to try and keep our population healthy. Look at the consequence of ill health. In case any of us, unfortunately, were to have a heart attack or a cancer, we would wipe out our life savings. A cardiac procedure would cost you 2.5 lakhs. Cancer would cost you anything between 5 and 10 lakh rupees. Which of us has that much money saved? Our entire life savings can be wiped out. And therefore, health has a tremendous economic consideration. And we've realized this. In the United States, for example, they have what is known as WOW, working on wellness. That implementing a health system reduces Medicare costs, improves productivity, improves profit. It is not a cost, it is a return. And therefore, implementation of health in the United States is now implemented by all corporate organizations and encouraged by the government. Perhaps the leading country in the world in terms of health promotion is Singapore. They have what is known as a school health program, which means that health is taught in schools. It would shock you to know that more than 50% of our children in our cities are overweight. It is important to manage child health, because if you do not manage child health today, you will pay the price in medical costs tomorrow. And I assure you that at this point of time, when our children grow up, if we do not take steps today, their health will be worse than our health. And therefore, school health is important, workplace health is important. How do you implement workplace health? You could make available health screening, you could make available health education, you could make available health implementation by creating the systems. You could make available 5-minute exercise programs, you could make available a 5-minute meditation programs. Corporate organizations around the world are doing this. Glaxo, Motorola. In Singapore, the Civil Aviation Department, the Police Department. And coming into India, the multinational corporations and even the Tatas are all encouraging wellness. Talking about the Tatas, in the 1990s, the Tata Group of companies discovered that ill health was a major loss. Hypertension, diabetes, heart attacks were taking away from the workforce important employees, productive employees. And therefore, they embarked on a 3-phase program: health checks, health education, health implementation. from the worst statistics in the world, they became the healthiest company in the world. And today, at 44% heart risk, it is better than world standards. At 29% cancer risk, it is equivalent and better than national and world standards. Their obesity levels have dropped to 49%. Their physical fitness levels have improved. Their stress levels have dropped to 34%. The national level is 41 and the international standard is 55. They've reduced smoking, they've reduced alcohol. And most importantly, they have reduced Medicare costs by more than 10 crore rupees in a single organization, which only proves that the implementation of health reduces Medicare costs. So what are health and wellness solutions? The first is to encourage health checkups in addition to medical checkups. The second is to encourage the creation of wellness professionals. The third, make available health education, improve health facilities, implement corporate healthcare in the organized sector. All multinational corporations make it compulsory for every employee to undergo a health education program. This concept must filter down to our own national and Indian organizations. We must create more and more wellness clinics, more and more wellness facilities. As many hospitals as we have, that many health facilities we must have. So what is the advantage of wellness? The advantage of wellness is that it touches individuals, it touches corporate organization, it touches communities, it touches lives. It benefits us all. Thank you.
Armed with this information, friends, ask yourself how many of you are part of the 15% healthy lifestyle group, and how many honest ones are in fact part of the 85% not so good factors, and how many others are blissfully unaware of where you stand in your lifestyle.